Hello everybody. So today we have a lovely client in here and she is about to have some extractions done. So before we do the extractions, we like to run through just little bits of information about what extractions involve and also the risks and the benefits of extractions. I don't want to end up with a really long video, but I'll talk through it anyway, and then perhaps I'll send it in different short recordings. So with extractions, what we've explained is in terms of what the client is going to feel, we always make sure the tooth is really, really numb beforehand so that it's more comfortable for the client. So in this particular case, our client was a little bit nervous, a bit apprehensive. So we applied some numbing gel first before doing the extraction. So we're going to give it a while, some minutes for the extraction, for the anaesthetic to soak in, to make sure the teeth are completely numb. And before we start, we will check the teeth. There's lots of checks that go on just to make sure that the teeth are well and truly ready for the extraction and that the patient is most comfortable throughout the procedure. So in terms of the extraction process, we explained to our lovely client how it might feel. So things like pressure. So even though you're numb, you can still feel movement, you can feel tightness. And I think that's the analogy I give. If you squeeze your shoulder, you can feel the pressure, which is quite uncomfortable the harder you press, but her pain senses have been locked off with the anaesthetic. So pressure is one thing. During the procedure, she will also hear probably some funny sound effects. So things like crackling. I know it might sound a bit alarming, but you may hear all sorts of funny things because remember, we're removing a tooth from your body. So there's a little bit of movement that's going on there. So another thing actually what we explained is in terms of things that could go wrong, we're not expecting them to go wrong. So it's not a matter of us saying scary things to make you feel even more nervous before the extraction, but these are what we like to run through. This is what we need to do in terms of a patient being fully informed about their decision to have the extraction and to be fully aware of the risks and things that can go wrong during an extraction. So one of them is the pain. So with any procedure, always expect a degree of pain. We're hoping this pain will be controlled, but nevertheless, it is pain. So in terms of dealing with pain, we'll run through analgesics, painkillers, things like that afterwards. That's number one. So other things to she might experience as a result of extraction would be sometimes there's a bit of could be damage to the teeth around. So imagine just trying to remove a tooth. That talking action can sometimes mean that you're rubbing against the teeth either side, so there's a risk of damage of the teeth.